Psychoanalysis, internalization. Namaste. Klein gave great significance to internalization process happening in early childhood. Conversation today is centered on this critical area in psychoanalysis with our consultant expert, Dr. Himanshu Vaidya. Namaste, sir.
Namaste.
Sir, how do we locate internalization in two-way traffic in the psyche? The outside in and inside out?
It's a good question, locating this phenomena. In the psyche, we see three kinds of zones and activities. One is movements inside out. The second, movement outside in. And third, a zone where other phenomena, activities are happening, but neither of this is important. It is neither inside out nor outside in. It's a separate zone altogether. So all the three zones exist in the psyche. All the three types of activities exist in the psyche. Coming to the first part of inside out and outside in. Let us take a few examples of movements outside in and inside out. When we look at inside out, we look at movements like displacement, transference, projection, projective identification. We look at fusion. We look at I thrown everywhere, attachments thrown everywhere from inside out. We look at movement of fantasy from inside to our behavior. So these are all inside out movements in the psyche. Now, when we look at the outside in movements in the psyche, they happen to be incorporation, internalization, identification, introjection, and reverse projective identification. There are many movements, other movements also of the same. In both the categories, there are more things to add, but 5 examples should suffice in each category. Now, today we are dealing with an outside in movement, internalization. So let us look at the 4 or 5 outside in movements that we looked at and see what is the difference. The first, incorporation, is very early life taking in, meaning you visually and literally take in something from outside. So it's almost like you are taking in the whole picture of the mother along with all the characteristics literally into yourself. That is incorporation. So this is more like Lacan's real stage, or movement in the Lacan's real. You take something literally in. So if a small child says the mother is inside of me, he has literally taken the mother in. The next stage is of internalization, which involves some sort of symbolization and a clear difference of I and not I. It is like a small child says to another small child, don't do this. Mother will scold. Mother tells me this is not right. Now mother is nowhere around, but the mother is internalized in him. So he does not do something, does not allow anybody else to do it because the mother says no. So he has still not adopted the value himself, but he has done it out of obedience to the mother. These values still are mother's values, not his values. So inside the mind, there is he and there is the mother. And the mother says, don't do it.
So technically in incorporation, this is happening before coming to the stage of knowing I. There is no self in the psyche.
Incorporation incorporation can happen after I and not I also.
Okay.
Because essentially it is the core feature is the absence of symbolization and the absence of assimilation.
Okay.
In psychotic, many of the extremely psychotic patients, we can see incorporation even as adults.
True.
Even though the I and not I is very clear, yet at times that I and not I gain in the psyche is undone. Or even if it is there, the incorporation can still happen. So it's a very psychotic activity if you look at it from a neurotic and psychotic point of view. Extremely psychotic activity. And if you look at it from a symbolization point of view, I think that is the core, that the symbolization is absent. The reflection which can alternately assess is absent. So it is what it is. To be more precise, the symbolization and depressive integrative thinking are absent. So one, it is literally taken in. Two, it is obeyed to the dot or disobeyed to the dot. So the split is in operation. And therefore the integrative realistic thinking is completely absent. So we can talk about two core features of this incorporation process. One, absence of symbolization, and two, absence of integrative realistic thinking, IRT. So incorporation is literally taking in. Then you have internalization, where the obedience is not so strong, but it may be, it may not be. But there is a taking in which is literal in one sense, but not in the sense of the full size and shape, but in the sense of a second person. So the taking in is not literal, right? But it is as the person says. So you have you and you have the person, and the person tells you don't do it, so you don't do it. And after some time, identification happens. So from internalization, you move to identification, where this internalized entity, the mother, becomes one with you and modifies you in this process. Now it has become one, it has gone somewhere inside and you have got modified. Now only you remain, but the you already contains the mother dissolved into you. Right? So you move from the incorporation stage to the internalization stage to the identification stage, when the other becomes a part of you. And then what you say is, this should not be done because this is wrong. Then you don't say this should not be done because the mother says it is wrong, because the mother is now a part of you. Right? This second has dissolved into the first. Now only the one remains with the second dissolved into it, and the dissolution process changes oneself. Like any identification changes us. Right? So when we look at the inward traffic, outside in traffic, we have incorporation, internalization, identification. We also have reverse projective identification. The other makes projective identification into us. And we also have introjection, which is like you project something out. Right? And then whatever appears outside, you introject that again. So it's a cycle of projection, introjection, projection, introjection. Right? And this happens very early childhood in a very psychotic way, where the most difficult parts of the psyche, which are difficult to handle, are thrown out. So then the other person appears like that, and then unknowingly some part of it is introjected, or it's seen as invading us. So these are
won't it be like the way Kleinian had mostly talked about the relevance of any of the concepts irrespective of the developmental stages. So is it possible that this can take place like in case of psychotic patients later in the life as well?
You are right. These are all universal processes. The degree, frequency, intensity, and the outcome differs. So you can find
primary as well as later days stage also. Anytime this can be happening in any stage of life, in any phase of life.
Correct. So identification, internalization, and identification keeps happening all over life. In case of psychotic patients, you can see even as adults, you can see incorporation. You can also see the cycles of introjection and projection. And one of the discussions we are going to have is in very soon is what is in me but not mine. And that goes into one of the factors there is of reverse projective identification, that the other person does projective identification into us instead of we doing it to somebody. Rather, let me say we doing to somebody, whatever name you use. One is we doing to somebody, somebody doing to us. So one, you will use projective identification. Second, you will say reverse projective identification, whatever nomenclature we use, but projective identification done by others into us. That also is one traffic coming from outside in. So when we look at the outside in traffic, one of the elements of that outside in traffic is internalization, which we are looking at today.
What you talked about reminds me of most of the romantic companionships, the reverse projective identification. So sometimes.
Correct. And it's very important, this internalization, why we are discussing so much.
So if we move ahead, what is exactly the internalization and why is it so important for a psychic life?
Yeah. So
is it something which we cannot skip at all in the process of life, or it is something very essential?
It is both natural and essential. In the sense, we are hardwired genetically that early in life, these processes have to happen. So it is not that the child decides consciously that Monday 4 o'clock, I will start internalization. And I will go until 7 o'clock and then I will start again on Friday 10 o'clock and go until 12 o'clock. It's not a conscious activity. It's not a planned activity. Even as adults, we can't will it. It's not a willed activity. It's a spontaneous, unconscious activity of the psyche for which we are hardwired genetically. So internalization means that you make a part, you take somebody from outside and put that person in. And that happens at two levels. One is at a semi-literal, semi-symbolic level. Like the mother tells me, don't do it. Now, at that moment, the child is not essentially looking at the physical form of the mother, even in the inner world. He can have a symbolic presence of the mother, right? A non-physical presence of the mother, that there is a thought that the mother does not like it. It's not necessary that he physically in the inner world sees the mother 6 feet tall or 5 feet tall as she is. So there is a quasi-symbolic activity there or a fully symbolic activity there. Yeah, I was saying something.
Yeah, I was just coming in touch with this part of it. If is it to do with the pre-thought state of the child, because of which there is no self-thought, self-voice, thus he incorporates the first voice or the thought system, belief system of the mother.
The sophistication of thought would not be there because thought will be there even at the incorporation stage. So thought as an activity will be there.
Phenomena would be there. The phenomena would be there of the thought, but there is no concrete format of thought formation because there is no language.
Incorporation is more of a pre-linguistic activity. Not that it cannot happen after language. We see that in psychosis, it happens even post-language. In severe regression, we see it happens post-language. But primarily as a natural activity, it is more of a pre-linguistic than a post-linguistic activity, incorporation.
So when we say it is a pre-linguistic, does it mean that it is because there's a blank slate and whatever reflects on is incorporated immediately, irrespective of whether it is correct or incorrect?
Correct. That is true. That is true. So it's a, when we look at the capacity to think, and if we go into this entire journey of developing the capacity to think, at some stage of the journey, we are doing incorporation. Later on, it's more internalization. Later on, it's quick internalization and identification. And then conscious learning without having to undergo the process of internalization and identification. Just a pure cognitive learning. So in a cognitive sense, these are like phases, psychocognitive phases of development of thought and affect. It's a maturity of the thinking process viewed from one point of view. Now, internalization, therefore, it's definitely outside in, and it definitely is quasi-symbolic and quasi-prematurity process. Now, this can happen in two ways. Internalization can happen of persons, right? Or internalization can happen of non-persons, right? And this internalization may have a limited shelf life, or it may become a part of our core personality and remain there forever. Now, this is where the temporary internalizations happen and the permanent internalizations happen. So usually when we say internalization, we refer to the permanent internalization. And this you can see in dependent personality disorders, that if you leave them alone, they feel terrified. So they have to talk to somebody. And after they talk to somebody, mostly they prefer video, right? And after you talk to them, the shelf life of that internalization remains for a few hours, and then they again start feeling lonely.
Oh, yes.
And they again start feeling anxious. And again, they have to connect to somebody. Right? So that the presence of the person, right, led to some internalization apart from the real experience on the moment. And that internalization continued for some time. There was a limited shelf life where you feel good, and then after that again you start feeling lonely and anxious. And that happens to all of us. We come back from a gathering of friends and we feel very good for a few hours, and then again we start feeling lonely and anxious and depressed and demotivated and so on. So you have different types of internalizations. Now, the most important form of internalization is what Klein talks about, and that is internalization of the permanent nature of a good, reliable, stable object. And this is where the cardinal significance comes in. There is significance even on temporary nature, because there also we would like to study how long it remains and how can we increase the shelf life of that internalization.
Right.
And what can be done as do it yourself tools or exercises. So that's a separate area of inquiry. But today what we'll focus upon is the permanent internalization.
So when you talk about the permanent thing, I'm just getting in touch with, can a hallucination of seeing someone around can be a compensation to this permanence?
Yeah, it can be. In many cases, it can be.
Okay.
That what we are focusing today upon is the permanent internalization, and especially of the type that Klein refers to, which is a specific kind of internalization of a good, reliable, stable object. And this, according to Klein, is very important, because Klein says that this is the center of good mental health. And this is not only a center of good mental health, but also the center of good biological health, because in most of the autoimmune sicknesses, we see that a good, reliable, stable object has not been internalized. So that object deprivation at the very deep level of a good, reliable, stable object not being adequately there, adequately internalized, is at the root of biological difficulty and psychological difficulty. And therefore, this internalization discussion is very important because there are many kinds of internalization. We are focusing on the permanent type and specifically of the type Klein indicated, the internalization of a good, reliable, stable object, which is at the center and is a necessity according to Klein for good psychological health and good biological health.
So if we see this internalization, incorporation is happening like an auto
Process.
mechanism within oneself. So how is internalization different from learning? Because learning is also a mechanism or a phenomena where a child is absorbing things, viewing with the sensory inputs from the outer world. It is also an outside-inside process in the initial stage. How do they both differ from each other?
Internalization essentially is a transformation of the personality at the roots. Learning did not necessarily be so. Like, I don't know what is the boiling point of diesel. I can go to Google or I can ask somebody and learn it. It does not really change my mental health or physical health in a deeper way. So internalization is a personality transforming experience. It is a structurally necessary experience for developing a healthy structure. Now, as a result of internalization succeeding or not succeeding, certain learnings happen. For example, if the internalization is successfully done, that around you, you have a good, reliable, stable object, and inside of you, the environment is good enough to internalize, the outside and the inside both being conducive, you internalize a good, reliable, stable object. That creates templates like, I am good, I am lovable, the world is a safe place, I am safe. So these templates, these learnings happen as a result of that internalization because you have had good, safe, reliable objects around you for adequately enough time that you could internalize it. So you have good objects around you and for a reasonable enduring time. So you decide to internalize and you internalize, and inside also there is no resistance. So the outside is conducive, the inside is conducive, you internalize, and therefore the templates created are, I am good enough, I am lovable, the world is a safe place. And the qualities which emerge in the personality are of completeness, strength, stability, robustness, positivity, energy, love.
Self-esteem.
Yeah, good self-esteem, openness, risk-taking, going out to people, the desire for closeness. These qualities automatically will emerge out of that experience. So as a result of internalization, learning does happen.
So if we see the Freudian model, mind model, mental model, so internalization is happening in the unconscious and pre-conscious, and learning is happening in the conscious state. Where do we place these two?
Learning happens at all the levels.
Learning can happen without
learning happens at all the levels. Learning can happen without internalization. Learning can happen with internalization. Right? Hello.
Okay.
Yeah.
So it can be conscious and unconscious both.
Yeah.
Hello.
For example, you see the father behaving to authority figures in a particular way, and unconsciously you learn.
All right.
There is no internalization of the type that we are referring to. There is internalization of a template. There is internalization of a behavior. But
Hmm.
that structure transforming object internalization is a very special kind of internalization. So we can have learning. For example, you go to school and the teacher tells you A for apple, you learn A for apple. You don't see the kind of internalization Klein refers to, although learning is happening.
Hmm.
And then you see internalization successfully happening and learning happening as a result of it, about the world and about the self.
Right.
And then take another example. Internalization process does not happen successfully because of factors outside or inside. What are the factors we'll go into in a moment? But let us say outside and inside factors are not conducive to good internalization of a good, reliable, stable object. And then what happens? You develop templates like, I am not good enough. The world is not a safe place. You remain anxious. You remain low. You don't have the confidence to go out and command people or collect people. In Kohut's language, an unhealthy self develops. So the fragility comes in. The lack of strong self comes in. The negativity comes in. At times, the autoimmune suffering comes in. Fragility of mental health comes in. The world is not a safe place comes in. I am not good enough comes in. I will be abandoned comes in. So when the internalization is not good enough, then also learnings happen, which are at the root of what we call the negative automatic thoughts. The core beliefs, if you want to use that language. They are as a result of these experiences that a kind of a permanent object deprivation sets in. And therefore, the personality in the adult age always is struggling with loneliness. And we see that in the West, loneliness has become like a psychological pandemic. And one of the reasons is not the only reason, but one of the reasons of this pandemic, this undeclared pandemic, so to say. WHO has not declared, but I have declared. So this kind
And you're
of
so
thing,
right.
yeah. So it's one part of my bravery. So if you look at that multifactorial phenomena, one of the factors there is because of inadequate amount of and number of and quality of good objects around children in early childhood, permanent deprivation has remained in a large component of society, especially when both the parents are working. So now you have generations in the West and in the metros in the East, where early life, inadequate number of objects, inadequate quality of objects, inadequate quality of peers and playmates, inadequate quality and quantity of the village around the child, so to say, right, has caused almost a pandemic of inadequate or bad or no internalization of good, reliable, stable object. And we see the outcomes in terms of mental health and autoimmune sicknesses on a epidemiological scale. So this is where the importance of internalization of a good, reliable, stable object comes in, that it is the foundation of mental health, biological health to some extent, and definitely health of the society at large.
When you talk about internalization in the Freudian concepts, where it is happening? Is it happening with the ego, superego, or id, or
It's happening in the unconscious,
unconscious?
in the id.
In the id.
The id.
Okay.
If you look at it that way, in the id, topographically, structurally speaking, in the unconscious.
You talked about outside, inside objects, environment, caretakers, primary caregivers. What facilitates internalization? And if at all something opposes it, what it is?
The first nature of this process is it's an unconscious process. It's a hardwired process. Nobody can will it and nobody can make it happen the way he wants. It's related to the autonomous part of the system. So in psychological sense, we will say it's the unconscious at work. It's an unconscious process, spontaneous process, hardwired process, natural process. Now, facilitating things would be that in the environment, there are good, reliable, stable objects who are benevolent, loving, and stable. And they are around us for a long time. So in technical language, we will say similarity, contiguity, and adequate endurance. The people around us, the objects around us, are near to the idea of a good object that the child has built up. They are there for a long period of time, and they are there doing good acts. So the presence, the contiguity, the presence of people, first, presence and availability, second, the goodness, and third is time duration. These are the three core issues in the environment which will facilitate. And the fourth issue, so these are environmental issues. And then internally, there are certain issues which will facilitate or oppose. Right? So externally, we would say good objects have to be available and present. First, present. So good objects have to be present. Good objects have to do good deeds, and they have to be around us for a reasonable period of time. And when we say good deeds, it covers the whole of mirroring, all the 5 A's, right? Acknowledgement, attention, acceptance, affection, and admiration. So this, apart from nourishing and taking care of needs and all of that, the good objects have to do this. If this is coming from the environment, and if the good objects are empathic enough, right, then this is the environmental facilitation for internalization of a good, reliable, stable object. And inwardly, there are certain things which have to be there. First is, one of the things that does not allow internalization of a good, reliable, stable object is envy of the good object. That you start fighting with the good object. Second is the narcissistic rage. If narcissism already has formed before internalization can happen, that how can there be so much of goodness in anything other than me? Then you have the mirroring failure or the idealizing failure from the environment. Or there might be too much aggression inside, where attacks happen so difficult on the bad breast that then you are not able to go into depressive position. The split remains open. Or there is no containment, there is no good container. And therefore the processes to naturally to happen have not happened. And therefore the foundation for internalization to happen is like a flight landing. That airstrip is not ready. The ecosystem is not ready to facilitate internalization. So these are the inner factors.
There can be greed also to rob away all the goodness.
Yeah, there can be greed also. Correct. Correct. So there are external factors, what we discussed, the internal factors, and both of them, right, together are necessary for internalization of a good, reliable, stable object. And that would create the core of good psychological health and to a large extent biological health, if we go by what Klein says. And many people believe that. In fact, Kohutians also believe it. At times you feel Kohut and Klein are talking about the same thing. That in fact, the internalization of a good, reliable, stable object allows the formation of a healthy self. and the internalization itself is facilitated by what Kohut lists out as the factors facilitating creation of a good, healthy self. They might be leading to creation of the good, healthy self through facilitation of internalization. It might be internalization is the one more deeper elemental fact than the macro phenomena of self-formation that Kohut talked about. So,
very interesting.
2 minutes are remaining. Can we take up the other questions in the second part?
Sure, sir. So we continue the same discussion in our part 2 of the series, internalization and Kleinian's view. Thank you.
Thank you.